checked my order and identified my patient and given a pain pill 30 minutes before doing the procedure. I have explained what I will be doing, which is a sterile dressing change, and I have performed hand hygiene, and now I will do the dressing change. So I will pull my covers back and expose the wound while still providing privacy as much as possible, and then I will remove the ABD pad, and while I'm doing this I will be looking for any odor, any drainage, anything like that, and I would get one Q-tip and measure the length of the wound. It's about 13 centimeters long and across. Which is 3 centimeters wide and deep. And I want to do this without touching the wound too much. And again, 3 centimeters deep. And I will throw that away. And then I can remove my clean gloves, and I would perform hand hygiene again. And now I can open all of my stuff. And then I would get my normal saline to dampen my 4x4 gauze pads that I'm going to use to clean the wound and pack the wound. And you would have your saline, and you would want to lift the bottle, just pouring some of it out, which I won't do. And then you would pour some saline over your gauze pads. You don't want them too wet, just moist. And now I will put on my sterile gloves, and I would perform hand hygiene again. Now I'm sterile. Okay, I want to start by cleaning the wound. And you want to use one gauze pad and clean the center first and throw away. And then the outside and throw away. And the other side and throw away. Next, I would want to pack my wound. want to fluff your gauze. I would want to also dry the wound so that the skin is not too overly moist. However, I don't have enough gauze pads to do that with the supplies that I have. So just be aware that in a real setting, I would have an abundance of supplies and would be able to do it. Now, I have fluffed my gauze. Now, I will get a Q-tip and you want it to be packed loosely and none of the wet gauze laying on top of the skin. Next, I would use gauze pads to cover. And then lastly, my ABD pad to lay over top. Now, from here, I can remove my sterile gloves and perform hand hygiene, and then put on clean gloves to tape the wound. Okay. Here we go. I would want to put my initials and date and time the dressing so that the next person would know exactly when this dressing was done and who it was done by. After that, I would just want to clean up my area, cover the patient back up, leave the call light within reach and leave the patient in a safe position, and then go and document everything that was done and my findings.